Acute pelvic pain in women is a classic USMLE Step 2 scenario, and missing the diagnosis can be life-threatening. In this video, we'll build a simple clinical framework to differentiate the most tested causes. So let's say that the question mentions that the woman is of reproductive age. We have to figure out if she is pregnant. If she is pregnant, then this is most likely going to be a case of ectopic pregnancy unless proven otherwise. If she's not pregnant, then we have to think of other ovarian or infectious causes. So let's come to the differentials. First off, we have Mittelschmerz. This is also called ovulation pain in the common language, and this is very common actually in a lot of women. It's a recurrent, mild, and unilateral pain that occurs prior to ovulation. So the pain usually happens on the 14th day of the patient's cycle. Then we have ectopic pregnancy. This is a life-threatening situation, and the clinical presentation is that of a woman who has amenorrhea, I mean she's not having her menses, and she has pelvic pain. She might or she might not have some vaginal bleeding as well. Pregnancy test will be positive, so positive beta HCG, and ultrasound will show that she does not have an intrauterine pregnancy. So this is the clinical presentation of an ectopic pregnancy. Next off, we have ovarian torsion. This is a sudden onset unilateral pain. And with the pain, the patient might have some nausea and vomiting as well. All right, so on examination, the patient will have unilateral tender adnexal mass, and when you get an ultrasound done with Dopplers, it will show that the ovary is enlarged with decreased or absent blood flow to the ovary. So it's also a surgical case, just like the ectopic pregnancy, which can be medically managed or surgically managed. Next, we have ruptured ovarian cyst. This is a sudden onset, severe unilateral lower abdominal pain, just like ovarian torsion. However, the question stem will mention a precipitating factor. This usually happens after strenuous exercise or sexual activity. The ultrasound will show pelvic free fluid. All right. Last, we have pelvic inflammatory disease, PID. This is an infectious cause of acute pelvic pain, and clinically, the patient will present with fever, chills, vaginal discharge, lower abdominal pain, of course, and on examination, there will be cervical motion tenderness. Ultrasound might or might not show an O-tube ovarian abscess, which is basically a complication of PID. So just remember that in the question stem, there will be clues to guide us to the right answer, right? So if it's a Mittelschmerz pain, then the key pointer to look out for in the question stem is it mid-cycle pain. If it's ectopic, the question stem will mention that the woman is pregnant. If it's ovarian torsion, the patient will have associated vomiting with the pain, and the Doppler ultrasound will show that the blood flow to the ovary is decreased or absent. Similarly, if it's a ruptured cyst, then the ultrasound findings will be that of pelvic free fluid. And last, we have PID. Key pointer to look out in the question is cervical motion tenderness and fever.